have outnumbered available bed spaces in states like Lagos and Kano, perhaps because of the population. As the number continues to rise, the government is faced with the challenge of providing additional bed spaces, making use of schools and hotels as some of the options government have previously forwarded. But now, the Nigeria Center for Disease Control says it is considering home care for COVID-19 patients, just like Kenya. Well, joining me via Skype from Denmark is Chief Physician and Professor of Human and Veterinary Medicine, Professor Ade Ojeni. Good morning. Thank you for joining us in TVC Breakfast.
I'm delighted to be part of your show.
Thank you so much. First of all, let's get your perspective to how the Danish government has been able to handle the COVID-19 cases, especially with its amendment to the Danish Epidemic Act. How has this helped in the management of the pandemic there?
Enormously, enormously. What they did was to adhere to what the experts say. The epidemiologists, internists, heart specialists, environmentalists, immunologists, and virologists. Now, what they did was to carry out tests. Secondly, to isolate and even trace contacts and enforce, well, I wouldn't say enforce, I would say the general population is quite enlightened, is masks, wearing masks, washing hands with soap and water, and where possible, and of course it is possible in Denmark, throughout Denmark, sanitization. Now what they've done, and are still doing here, is that all entrants to any establishment, stores and so on, every entrance is equipped with sanitizers, and most people are wearing masks. See, those are the two key elements: masks and hygiene, and distancing, social distancing. I know it can be quite a challenge back home in Nigeria or in other parts of the world to have this social distancing because you have very crowded spaces. So that had been the key to the success here.
All right, some would say that perhaps it's because it is a homogeneous society. That is why it has been able to record as much success, unlike what we see in Nigeria, that is a heterogeneous society, so to speak. And so it has been faced with different challenges. What do you make of this?
Well, it depends on how you define heterogeneity and homogeneity, because the measures that have to be taken are quite independent of how homogeneous or how heterogeneous a society is. As long as the amenities are there, once people know exactly what to do, then homogeneity, heterogeneity play very little or no role at all. And that's why our experts, our medical experts back home, the frontline workers, I really take off my hat for them, because they are the real heroes of this fight against the pandemic.
From what you have observed with regards to Nigeria's handling of the pandemic, you mentioned earlier about information. How would you say the government has been able to manage information dissemination such that it is making as much impact with flattening the curve amongst the society or in the country in Nigeria?
Well, I think they've done a very good job, an excellent job, I would even say. And I think that has contributed a lot to the flattening, or the reduction at least, of the load. The important thing now is to ensure that those things that we preach as specialists, like these masks, are available. Masks should be available, soap should be available, water should be available, as much as possible, sanitizers too should be available. Once these things are available, I think most Nigerians are aware of the importance of these things. And once the information is given to them through newspapers, through radio, apps, short SMS, and flyers, and so on and so forth, and television, of course, all these things have wonderful impact. I think they've done a very, very good job.
But now we have a situation on the ground. Nigeria is running out of bed spaces, and the cases are rising. We haven't, as experts would say, gotten to the peak, yet we are already experiencing this. How much of a peculiar challenge is this to the country?
Well, it's the whole situation is new, and I'm not sure how prepared we really were, because we had to make do with what we had, and so it's been a wonderful challenge to the government, and I think I would like to think that they rose to the occasion. The Minister of Health, all the hospitals, the healthcare workers, once again, I take off my hat for them. They've done the absolute best they could and they can. That's exactly what they are doing. And I think I really take off my hat for them. With regard to the shortage of beds, it's, of course, not something that we were prepared for, at least not on this scale. And when there is a shortage of beds, what we can do is use other facilities to house those that need to be on admission.
All right.
And the isolation is of vital importance.
All right. I'm afraid we have to leave the conversation here now, Professor Jenny. Thank you so much for speaking with us.
You're most welcome.
You're watching TVC Breakfast. Nigeria has recorded 12,801 COVID-19 cases with more than 8,000 active cases across the country. The number of patients seeking treatment have outnumbered available bed spaces in states like Lagos and Kano, perhaps because of the population. As the number continues to rise, the government is faced with the challenge of providing additional bed spaces. Making use of schools and hotels are some of the options government have previously forwarded, but now the Nigeria Center for Disease Control says it is considering home care for COVID-19 patients, just like Kenya. Joining me via Skype from Denmark is Chief Physician and Professor of Human and Veterinary Medicine, Professor Ade Ojeniyi. Good morning. Thank you for joining us on TVC Breakfast.
My pleasure. Always at your service.
All right. Thank you so much. No doubt this is a global issue, talking the short or the lack of bed spaces. But let's bring it to Nigeria now, looking at the fact that cases keep rising on a daily and it's yet to peak. The government is looking at perhaps home treatment, but there are concerns for a majority of Nigerians. The question with regards to how many Nigerians can provide extra rooms for any person who comes down with the virus. Now, is this the way to go, first of all?
I have my doubts because, number one, as the anxiety grows in the society, housing simply can't accommodate such a project or such a way of treating patients at home. It would also demand an enormous amount of healthcare workers to take care of single homes. It would be much better off by having centers where, whether it's schools or it's halls or yards or wherever it is, that beds can be arranged. Home care, that would be extremely taxing.
All right. So, but some have also talked about perhaps the government liaise with some businesses, work with schools or perhaps hotels who can provide services. Could that be another way to go?
Again, it depends on what these outlets really can provide. Do they have the health workers, the experts, those who know exactly how to treat patients? I have my doubts.
So what would be your suggestion for the government at this point if we are to address this head on, seeing the increase in the number of cases?
Well, my suggestion would be that we make use of available spaces, where it is schools, it is halls, it is some buildings where you have enough space to put beds and the healthcare workers. Again, they are the focal points is the healthcare workers, the first line workers. Those are the ones that you need the most.
All right, Professor Adeojeni, thank you so much for speaking with us on the program.
My pleasure.